introduce Dennis Tangway as the speaker that will be presenting on the challenges of remote hosting. Dennis Tangway is the Central Maine Healthcare's Chief Information Officer, and he is formerly the Director of Technical Services for Central Maine Healthcare and the Client Executive for Caretech Solutions. He is now leading upgrades of the clinical and financial systems for all of CMHC. Tangway's experience in healthcare information technology spans more than 25 years. He served as the manager of network systems while at Maine Medical Center. Mr. Tangway has a bachelor's degree in computer systems from Daniel Webster College and is a member of HIMSS and CHIME. And I wanted to welcome you, Dennis. Thank you very much.
All right, so thank you for joining us today. There's a little slight issue with the title of this on the agenda. We're going to talk not so much about challenges with remote hosting. We're going to talk about challenges that led us to remote hosting. Robert Rivas will pick up halfway through the presentation and actually talk about some of the technical changes that we made as we got into the, once we made our decision. So, a few things we want to make sure that we cover today and that you all are able to walk away with. So, considerations to address in a data center evaluation, alternatives to building or expanding, and other benefits.
Excuse me, Dennis. They can't see the overhead.
Oh, am I standing right in front of you?
Yeah, if you don't mind. Thank you very much.
Obvious stuff, sorry. So a little bit about Central Maine. I was trying to stay in front of the camera. I told her I would be walking around. So a little bit about us. We essentially have about 4 hospitals that are part of our system. Parkview, which is not on this, is managed by Central Maine. You can see we have 3 hospitals, 2 critical access hospitals, and Central Maine being the larger of the hospitals. A few other statistics there we don't need to go into. So we're about a $500 million in annual revenues. So we're a pretty busy little system. Probably the 3rd largest in the state, right behind Eastern Maine. So we're pretty busy. A little bit about our technicals. We're somewhere around 189 applications. We use Cerner for our outpatient systems, GE Centricity for outpatient. As was just mentioned, we're in the middle of some pretty large upgrades. We're replacing McKesson billing with Cerner billing. So that's a pretty big project for us. We've just replaced McKesson financials with Lawson, and that's gone very well. I got April 1st. We have the site supported. We actually have about 85 practices that are scattered across about 50 or so sites. As everybody knows, disaster recovery continues to be a sort of an elusive goal for a lot of people, something that we've worked hard to stay on top of. I'll do the next one. So, stepping way back in time, so before I became the CIO, about 10 years ago, Central Maine had lots of challenges facing it. This expanding number of practices that we were looking to have joined the system, and keeping up pace with that. We had, like everybody else, limited access to capital, lots of demands for capital, and as everybody knows, continued reductions in Medicaid, Medicare funding. State still owes us a few bucks, so we're working on that. Next one. We had lots of disparate clinical and critical systems, so everybody, I'm sure everybody here has experienced that, best of breed. Lots of different, everybody came to the table with lots of applications that, this one fit this niche really well. So we've got we've had a lot of different applications, and over the last few years we've been working to consolidate those and eliminate some of those, merge them together, move to a single environment. We're still a little ways off from that, but we continue to work in that direction. So some of the technical challenges, as we were expanding, keeping pace with the technology, the cost of the technology, having resources that could keep pace with the technology. There were lots of consulting firms that are in the area that were more willing to take your money and help you out with that. So it was getting costly for us. At the same time, things changed dramatically on the availability of the systems. We went from, it was nice to have this thing and be able to use it when we need it to, it must be up all the time, as you guys well experienced that. About 10 years ago, we went to an outsourcer. That outsourcer was a very small company. It's about a 1,500 employee company. We had a really good experience with those guys. They got purchased by a larger company. We became a little disenfranchised with them. Became, impersonal relationship, as well as the costs started to escalate on us. So as laid out here, we put, and at that time, all of IT was outsourced. The analyst as well as the technical infrastructure. And the CIO was an outsourced CIO. So about 2 years ago, we put together an RFP to lots of vendors, Dell, IBM, Cerner, and a few others. At that point, the decision, as we looked at doing that RFP, the decision was made that we would bring the CIO back in-house so that they really had a seat at the table. We felt that as time went on, the CIO for the outsourcing vendor was not really working for us. Costs were escalating, and it was obvious that they really weren't working for us anymore. So, next slide. So some of the considerations that we looked at: buy versus build, the cost of building a new data center, not only the capital but the ongoing costs. We looked at the resources to support all of IT and the scalability of what we had. We had a pretty good infrastructure, but with a focus on bringing the practices and focusing the dollars there, we really needed some help technically as well as cost-wise to come up with a more of a stable, consistent cost for the organization. We started looking more at outsourcing and what it could provide us. So a few things that you can see that are, for example, the operating costs. Build neutral, upgrade neutral. With a partner, of course, you spend a little bit more with a partner, so operating costs go up a little bit, but again, it's a predictable cost. So one of the things I'll elaborate on that is because we use an outsource for IT, they've got lots of hospitals across the country that they do business with. When we have a technical issue of putting in some new infrastructure, we don't have to bring in new consultants. We make a call to the outsourcer. They send technical experts as part of our agreement to help us with that new infrastructure. So a new upgrade coming in, new network infrastructure, new applications, that's part of the deal. So after the RFP was submitted, we met did interviews with the potential candidates. We chose a new outsourcing partner. And at that same time, we decided to move from all of IT being outsourced, again, to bring the CIO back in, but not only the CIO, but the application analysts came back in. So now our new outsourcing partner is focused right on the technical. They provide a little bit of application support for us, but mostly on the technical part. They support the application from the infrastructure perspective and the DB perspective. So we don't have to have Oracle folks on site, SQL folks on site, some of the harder to find, higher level technical areas. So we chose Caretech, and Robert is the technical director for Caretech, and we'll speak to the transition that happened. So our data center with the prior outsourcer was located in Dearborn, Michigan. Our server and Centricity systems lived there, as well as the McKesson financials. Once we made the decision to move, we worked with our partner to move the data center, and Robert will get more into that. But one of the reasons we went with Caretech is they have lots of hospital experience across the country, supporting apps that we were running. They provided a scalable architecture for us, so there is some sharing that happens of resources. So We own most of the technology that lives in the new data center, but there is a lot of shared components of it, not only the resources, but the network infrastructure that's out there, some of the SAN equipment, so that kind of stuff. As I mentioned before, we now have a predictable, transparent cost structure, so we know what our costs are going to be on an annual basis. So as we're doing upgrades, we know what we're going to pay. We're not going to pay, what we're paying today plus, plus whatever else it's going to be if we have a predictable cost structure. One of the nice things about the new infrastructure that we use out there is if we need more disk space, more virtual servers, more Citrix servers, Caretech lights us up as part of our agreement. All right, Your Honor. This is Robert Previous, our Technical Director at Central Maine Healthcare.
So when we did the data center relocation, we have challenges when you move any data center, whether it's local or remote. We migrated a little bit over 100 servers from the previous vendor's data center to our Troy, Michigan data center. We completed some software upgrades at the same time, took that opportunity to take care of that. Some systems needed upgrades, as everybody I'm sure is aware. You turn something on and you don't upgrade it for a long time because there can't be any downtime. We implemented our high availability within 4 months rather than 6. And at the same time, we launched the Caretech Solutions Service Desk, which was help desk, triage first calls and things of those nature. Want to hit the slide? That's a partnership right there. The highlights of our data center relocation were really about minimal downtime and our clinicians being back online within 24 hours. That was a big key part. You don't want your clinicians to be without the system. 300% immediate response time improvement. Our old provider, the network connectivity to their data center was significantly slower than the current provider, and we actually saved costs there. 100% immediate purge time improvement in the back-end system. A command center to rapidly address issues. So as we moved systems and things came online, if things weren't working or people were having issues, we put the command center in place so that we could address those issues as quickly as possible, get the right resources on them, and get them resolved. Clinical service desk availability, and the data center is a secure environment, at Caretech's facility. Results gained for Central Maine, in our ongoing improvements and obviously the peace of mind, they have a total cost of ownership. They actually own all of the equipment in the data center. It's not a leased piece of equipment, they own it. So the benefit for them is that flexibility that we need to pull a system back to the local data center for better performance or to work better with the system. They can do that whenever they want. Again, the predictable monthly cost structure. You know what your operating cost is every month. It stays the same, and you can predict it over the course of the contract. Highly available systems, with reliable data supporting the clinicians. Geographic transparency. The clinicians don't know if the system lives in our data center in Lewiston or if it lives in Troy. Access to state-of-the-art technology and expertise. One of the big benefits that Caretech brings to the table is they let the local staff do what they need to do. They don't get in the middle. They're the experts. But if, for example, if we're implementing a new solution, infrastructure solution, we have the resources available with Caretech to bring them in that have done this work in the past. Because they have multiple hospitals and multiple locations, we may say, for example, we upgraded to Exchange a while back. We were an old group-wise facility. They had the expertise to come in and say, we've done this. We've seen a larger and smaller, and here's how we're going to do it. So those are one of the big benefits. We have an SSAE 16 SOC 1 Type 2 compliant data center. That's a mouthful. Dependable and repeatable processes keep our data safe and secure. Dependable change control, auditing, logging, proactive monitoring of our IT systems. They have a health information operations center. They monitor all systems 24/7, 365 days a year. If there's any performance hits, any down systems, we're alerted immediately and everybody jumps into action. And then disaster recovery procedure was put in place. That was a large gain for us, being able to actually say that we can come back from a disaster. I think everybody plans on coming back, and until you actually have a system in place, you don't really have that in your back pocket. Additional value. Central Maine is currently completing their system-wide EMR financial and administrative systems, as Dennis pointed out. Where we bring a value there is we have experts in Lawson, experts in Cerner, experts in Oracle and SQL and all these other things. So they can leverage those resources out of the base monthly cost at no additional cost to the hospital. We provide supplemental infrastructure resources. We have access to network resources, Exchange, any of those types of systems. They can come on site or they can do it remotely. Again, all included in your base. And then Caretech's highly skilled technical talent, ensures that CMH business and IT goals are met. So when Dennis puts forth an initiative and says we really want to get encryption for email, help us meet that goal. We need to meet it by this time, and how's it going to happen? And, the relationship between the two sides, in the old days, the old outsourcer, it was very, I don't know a good word for it, combative, I guess would be the best word. With Caretech, it's not that way. It's very shared interest in making sure that everything runs right. The technical staff are all Caretech staff. There's about 21 staff, but one of the things that Dennis always says is we get paid by Caretech, but we work for Central Maine. Our first priority is Central Maine. That's what we do. I'm going to hand it back over to Dennis. There's some lessons learned that he'll speak about really quickly.
I'll actually slow it down a little bit. We've been kind of racing through this. Some of the things that Robert hit on, email encryption. So meeting some of our HIPAA requirements, we've been able to do with Caretech's help. So encryption of email, encryption of our desktops and laptops. So we've got that turned on. We use Citrix Hot Roaming Desktop with the help of Caretech a couple of years ago. We actually implemented it house-wide. We had lots of folks, physicians asking us for tablets. We were trialing on tablets, the rate of 2 or 3 every few months, and I don't like that one's too heavy, the battery doesn't work. After we went live with Citrix Hot Roaming Desktop, we had some laptops and tablets in the refresh pool, planned to go to physicians to replace the ones that they had. And the interesting thing was we found that as we started to go work with those folks, they didn't want them anymore. So they're able to roam around the organization anywhere, in any of our campuses, and bring up their desktop no matter where they are. So they go work in a particular unit, they suspend their session, they walk to another unit and bring that session right back up, right where they left off. So we've been able to, with Caretech's help and the experience that they've gained working with other hospitals, we get to leverage that benefit. So it's really worked to our advantage. I've worked with other organizations, and we've always struggled with that piece of it, bringing in the technical talent and the experience that we needed to pull those things out, and Caretech's helped with that. So some of the lessons we learned as we did our data center transition, which was really the focus of this slide. Data center transition was planned to take about 48 hours. We'd spent about, because of the number of systems and applications, we had planned for it to take about 48 hours. It ended up taking about 24 hours. So it was, with the help of Caretech and the prior outsourcer was, all worked up over the fact that you'll never be able to do this. You're going to have lots of downtime and lots of issues. With Caretech's help, we not only moved it in half the time that we thought, but we virtually had no issues. We had better performance. They had done this before and knew what to expect. So back to the data center transition. So some of the lessons we learned, make sure you include your stakeholders. One of the things we learned right from the get-go is, and as we work through the process, your stakeholders are your providers. You're not just the folks in IT, but folks that have to work through the down and go on paper backup systems. So we work with those folks to make sure that the timing worked for them. We pick the downtime with their help. So we made sure that everybody was involved, the analysts in IT as well as the physicians and the nurses out on the floor, to make sure we pick the right downtime, the least, what I like to call least impact time. So we engaged everybody we could, including even the outsourcer that we were moving away from. They had a lot of knowledge about our systems, what to expect. So they played, not very willingly, but we did get them to partake in that. So we created an elaborate work plan as part of that process. And the interesting thing was, as we got going into it, we started running into a few issues. And the work plan became sort of a high-level guide, even though it had a lot of detail. About an hour into it, the work plan was pushed aside. And we used it as a high-level guide, but as you run into the issues, all of a sudden the work plan doesn't sort of fit the model anymore. So that's one thing I recommend, that you put some good effort into a work plan, but it's not your Bible. Anything else? Another slide? Just before we get to questions, so Caretech really helped us improve what we do. We do pay a little bit more for it, but we don't pay lots of other consultants to come in and help us with stuff. So when I was at the prior organization, we paid, whenever we did a network upgrade, a pretty complex one, we paid vendors lots of money to come in and help us. We don't do that. Caretech has folks as part of their central source, shared services, but they also tap into the talent in the other hospitals. So our folks at the local site have been tapped for, in the old days, group-wise support, outlook, backup, SAM stuff, so when somebody's running into an issue. So we become part of a larger group almost overnight when we did that. So, and it really works to our advantage, where I believe that we're able, with that partnership with Caretech, we're able to do things that we otherwise wouldn't be able to do without spending huge amounts of money. So the partnership with Caretech has become an operating expense for us, and then, as we've mentioned several times, it's a predictable cost model for us. We are paying a little bit more for it, but we're not. I think we're saving because we're not paying all those other consulting companies. So, open up the floor for questions.
So Dennis, so Caretech is healthcare as their specialty. Is that something to look for an organization that understands healthcare specifically?
Absolutely, it's one of the things that attracted us to Caretech. They understand the high availability needs. They know the business. It's interesting, as we work with them to do upgrades and other things, you don't have to twist anybody's arms about what times of the day that these things should happen. They know they automatically focus to the least worst times for you. It's not a challenge. And with the prior outsourcer, there's going to be overtime, there's going to be this. We don't all kinds of excuses why they want to do it in the off hours. So they understand healthcare. They support hospitals all over the country. I think they're up to somewhere around varying levels of outsourcing. They go from anywhere from just help desk to web services to full IT outsourcing, minus the applications. We've talked a little bit about the assistance they give us with applications. It really is focused on the back-end infrastructure piece, like Oracle, AIX, that sort of thing.
So my follow-up is that it sounds like it's more for hospital systems and large organizations, less than maybe a group practice or a smaller organization that only has a few IT people, but wants to outsource their servers. Would that be their business case?
That's accurate. They really don't do, not that I know of, do practices. It's probably their cost model is a little bit higher than that, but probably puts them out of range for practice.
So they expect you to have your own internal IT department of some sort.
They do, and for example, our IT, when we moved from way back, when we moved from Central Maine full IT to the outsourcer to the current model, the staff moved with it. So many of the staff that we have today are working. They were there prior to the outsourcing even began, and they're still with us. So we've got employees. One of them just hit his 20th year. And one of the things we do, we work hard at the hospital, is to make sure those employees feel like Central Maine employees, even if they work for an IT outsourcer. They participate in the 5-year, 10-year, 15-year recognition award nights. They do get their paycheck from another vendor, but they do. We work hard to make sure that they know they work for Central Maine, and we expect them to act like Central Maine folks, and they do. The benefit for them being a Caretech employee is that as we struggle with costs in the health systems, things like training and that sort of thing start to plummet. The dollars aren't there for that. these guys working for Caretech, because other parts of the country are doing okay in the medical arena, they're able to get the benefit from that. So they've got great training plans. They're able to do pretty good spot awards and bonus plans for these guys. So things that we're not able to do really work to their advantage, because they're able to leverage other parts of the country that are not struggling as much as we are right now.
So those folks are still on site at your location?
Yes, they are.
So they work remotely through Caretech's systems?
So they have remote apps. They're full-time employees that sit in our offices. They have remote access to our systems, plus the folks that they work with back in Troy, Michigan have access to our systems. We have systems that live in that data center plus our data center, and they have access to the whole.
So other resources actually support you, not
Absolutely.
your. So
right.
it's a whole. They joined a family of people now
Exactly.
to support you.
Yep.
And are they still the ones that go out to install new equipment? What do you do for on-site services?
Yeah,
where
we didn't break
people
that. We
need
didn't
to
break
go
that
to
down
work?
very well. We have, as part of the Caretech arrangement, we have on-site. We have a help desk that lives in Troy, Michigan. So when you dial our internal help desk line, it actually gets redirected to a help 800 number out to Troy, Michigan. They answer the phone as Central Maine Healthcare Help Desk, can I assist you? And they'll create either a trouble ticket or a service request, depending on whether or not it's a problem, or a new request for mouse, keyboard, piece of software. The help desk will try to resolve as many problems as it can on the first call. Anything that can't be resolved gets dispatched to on-site field engineers. So we have about 8 or so engineers, one at each hospital, and then a number of others at the main hospital. So they'll work on the trouble tickets, and then if they also get service requests, those go in a pool. We have service level agreement around those, so depending on the type of installation, or they have to meet installation requirements. Depending on the criticality, it can be anywhere from 4 hours to 14 days, depending on whether or not something needs to be ordered. Did I answer your question?
Yes, you did.
Okay.
Yes.
Can you speak a little bit to what infrastructure was migrated into the remote data center and what infrastructure stayed at your core facility?
Yep.
And how you made that decision?
We really looked at the main clinical systems that we struggled to support locally. So those were the Cerner, McKesson Financials, and Centricity, mainly because they required AIX as well as Oracle support. Those were expensive resources for us, and quite often hard to find. I don't know about you guys, but in the past, when I've had an Oracle DB reporting to me, they have a certain personality. They're not always the most friendly people to work with. The folks in Caretech, we don't experience that same issue. They work hard to find folks that like to help people, like to improve the technology, and they do a great job for us. So we looked at the critical systems, the big iron stuff that's harder for us to support. We still have a pretty big data center in Lewiston. We have about somewhere around 400, 500 servers still live there. Our Outlook system lives there. Lots of our PAC system lives there. So a lot of still critical systems, but systems that we can support locally without the need for those higher level expensive resources that really, in honesty, even at my last organization, we had a couple AIX guys and a couple Oracle guys, and they were busy about 20% of the day. So by having them in a shared resource, they're not just supporting us, they're supporting other clients. So the cost is distributed that way.
I'm just curious, from a security perspective, how extensive was your vendor due diligence process? Just in terms of, do you just say, show me a copy of the SSA 16 and call it a day, or do you dig a little deeper, say, when was your last pen test, and can we see a copy of that report? Was it done by an independent third party, or
all those questions we did ask. So we looked at their certification, the type of data center that they had. For instance, they have their data center has biometric palm print readers to get into it. They have an off-site data center that everything is replicated to. That's secured and manned. It's constantly monitored. They meet the the standard security requirements, but they're also one of the other things we do is they are a partner, so we make them sign a BAA. So we hold them to the same standards that we would hold you folks in our own data center. So security-wise, they help us with our annual HIPAA security assessments. So they know the regulations, they know what we need to be abiding by, and they follow those same measures. Bill?
There has to be some downside, but I haven't heard you mention any of it.
You know, I would say the downside is it is a bit more expensive. So we do pay for, you get what you pay for. We are paying a bit more, but it does allow us, I think the costs get defrayed through the other things that we don't need to do. We pay more, but we're running what I consider, you know, leading edge technology because of that. That's an area that, even when I was at the other hospital, we struggled with. The nice thing about working with Caretech is they've done it elsewhere, and we're able to benefit from it.
Does the Tier 1 help desk model that you outlined, does that introduce some delay or in getting issues resolved quickly?
With the prior outsourcer, we had a lot of complaints. They were such a large company, 62,000 employee worldwide company, and they had outsourced a lot of stuff to overseas. So we had language issues when folks were calling the help desk. The current help desk, we this time around made sure that our contract states that help desk folks need to be living in the U.S. So I have not heard a complaint on the language side in a long time, but the 24-hour help desk works to our advantage because those folks are not only supporting us, but they support other organizations. And depending on where, you know, which 800 number is coming in, it displays in their phone. They know how to answer the phone. We do, from time to time, have some complaints, like any other help desk. You know, I worked at another hospital that had a local help desk, and quite often there are, you know, technician complaints. You know, so-and-so didn't help me fast enough, didn't know what they were doing. We still experience some of that. It's a normal help desk, but we do have SLAs. Part of the Robert's responsibility is to make sure that that we continue to improve that model, and we do. We meet with those folks monthly to review the calls, the types of calls that are coming in, the service agreements, the abandonment rate on the calls. So we go through all that to make sure that they are meeting our needs. Yes?
What percentage of systems do you still run in your data center at your organization? And does that help desk have access to those, that they provide at least Tier 1 support there on those systems as well that aren't hosted at the data center?
Typically the help desk will support folks with you know, the office productivity type stuff, mostly. So when they do, and they are helping with some of the server calls that come in, but typically they will dispatch those to the on-site folks. So they'll handle the, you know, the office productivity stuff. If I'm having trouble printing, you know, they'll check the obvious stuff, work on resolving as many calls on the first call as they can in that sort of arena. More technical, so if there's a network issue, these guys are getting alerted to it. The network folks actually out there are calling these guys, not the help desk. So the help desk really is focused on first level user support. And it works pretty well. I haven't heard a complaint in quite a while. With the prior outsourcer, we had a lot of complaints about the language barrier as well as the turnaround time. And moving with a smaller outsourcer really paid off for us.
And add to that, there is about 80% of our systems still live at the data center, Central Maine, and about 20% of the Troy data center.
Now, with that being said, so we have a lot of systems that still live in those, the big iron, the most important stuff, our clinical and financial systems that live in Troy right now. Troy,
What kind of infrastructural connectivity do you have back, you know, to Detroit and redundancies?
So we have a pair of AT&T fiber lines out to Troy, Michigan. That's worked out well for us. We have not had, most of the downs, we've had a few big downs, mostly caused by domain controllers, Citrix issues, SAN issues, and those have been short. We've not had a data line issue yet.
Okay.
Because we have a pair, we've had an issue with one leg or the other.
Yeah.
So they take one, they notice, they monitor it, and notice that one leg's having some error, some some errors on it. They take that leg down, we don't even feel it. They work on that. Typically, we push them to do it off hours, unless it's really causing some performance issues during the daytime. But that's worked out well for us.
What's the speed you're running across that line, do you know?
45 meg on each line.
Okay.
So
Pair of
they're load
45s.
balanced.
Yep.
One of the things too is when there is an issue, they notify the on-site staff. So it's not a matter of they're taking charge and running with it and we're not aware. The local network staff are informed that we're seeing errors on the circuit, we're seeing drop packets. We want to do X, Y, and Z. We need your help. What's the best time? We think the best time is this time. That is not a good time. You know, that's one of the other benefits that it's not driving it as far as here's what we're doing and here's how we're doing it. It's what do you want us to do? When do you want us to do it?
We have higher speed connections out to our practices than we do that.
Well, that's why I was wondering, because, you know, if you get this big iron off there in Detroit, you know, what's the throughput? What are you dealing with?
We use Citrix heavily, and because of that, we've not had performance issues at all. That works. We have about 3,500 connections going out there all the time simultaneously, and we have not had issues with that. So it's worked out very well for us. When we first did it, I was very skeptical.
Yeah.
Because we have much faster connections at most of our other sites, but we do a lot more of those. We manage the desktops at those sites, virus protection, encryption, all that. And we really do need that performance up to those. But because we use Citrix to talk to those systems out in Troy, it works very well for us.
The previous providers, the DS3s that they were using were about 31 milliseconds back to the, just making the hop back.
Right.
These are about 12 on average, obviously increasing with load. So what the users noticed the most was that huge change in speed, and the latency was significantly lower.
Is that 300% you were talking about earlier?
Yep.
Okay.
That circuit, the AT&T stuff, that's part of your additional cost, or was there?
That's part of the base fee. So the what we call the predictable cost is part of that fee.
So you contract with your Caretech?
Caretech takes care of all that.
And they monitor the network, so it's Caretech reporting errors, not AT&T.
Well, AT&T will they monitor it. They'll typically report an error and Caretech's already looking at it. So they usually catch it at the same time.
Your contract for connectivity is with Caretech or through AT&T?
Caretech.
Another benefit that Caretech utilizes is, those circuits are a great example. If there's a replacement circuit that we could get in and put into the hospital for the hospital, and let's say it was $1,000 a month for the DS3s and it's $500 for the new fiber circuit, and it will meet the performance guidelines, the hospital isn't locked into, we're going to pay for this thing, at that $1,000 rate for the next 3 or 4 years. Caretech's very good at, it's a savings to the hospital. Does it make sense for them? Let's move and move it down and help lower the cost to the organization as a whole.
There's one more question up back here.
Yeah, can you talk about high availability and how you provide that as far as disaster recovery?
Sure. We have a solution called Double Take. So we're a large VMware shop. We use Double Take for our system, so it's a bit-to-bit replication to a secondary data site, which is essentially an exact copy of our current environment in the Troy data center, as well as the data center down here in Maine. So what happens is if there's ever a failure of our data center, let's say, God forbid, water invades the data center, which I think we've probably all experienced in some way, they can, on the fly, flip over. The data is real time. The outage is a couple milliseconds actually, and everything just comes right back up. They keep the same amount of cooling of UPS, power backup in both locations to ensure that if their data center, the main data center at Caretech, were ever to go down, we would literally flip over to the other one within, I think the high time is about 4 or 5 milliseconds. So users would obviously see that because the majority of our users use the roaming Citrix desktop, as I'm sure everybody is aware, they may not see that. They may be in the desktop and kind of hum for a second, and then they're back online. So that capability is something that they built in right from day one.
The neat thing about Double Take is it manages not just the replication out to the system on the other end, but it also, when there is a failure, it manages the IP address changes, all that. So it is seamless. So they've been doing some testing around that, so it's looking pretty good.
An example of the DR on the Double Take, where Caretech has utilized that as a disaster recovery model. but where they've worked with the, my staff at Central Maine locally to utilize it in a different fashion. We've gone from, probably 85 or 95% physical servers to about 85, 95% virtual servers. Sometimes doing the VMDK doesn't work. Double Take allows us to actually replicate the physical to the virtual, let it replicate for however long you need, and then when you're ready to flip over, you literally just flip over, and it's in. They've had that experience in other locations. They've used that model, and it works very well for us. So our downtime for systems, as opposed to taking the downtime, creating the VMDK, moving it over, it's 10 minutes. We coordinate with the users. So those are the types of things that that system allows us to take advantage of.
Any other questions? A lot of good questions. Thank you very much for joining us.